Hello, it's Rafael Gutierrez, and this is a continuation of what I was talking about last time about how strong skin really is and some of the fallacies that actually you find a lot in martial arts. Now, before I do talk about that, do want to talk a little bit about just different things you actually do see around in martial arts circles. For instance, I was recently reading something on rank and what people think of rank is. And one of the things that I always tell my students and uh, people when they ask me about rank is really subjective and it's dependent on a lot of factors. For instance, different schools will have different standards. You also do have different organizations will also have different standards. And so a lot of times someone may be a 11th degree black belt on spinal tap martial arts, and that's the highest they can get to. Others, they have a 10th degree, and that's as high as they can get. There are also other things which are pretty interesting, and that is looking at different people claiming to have doctorates in different martial arts. Now, as far as I know, in the US at least, there's only one university that offers a bachelor's in martial art, and it is a subspecialty of their uh, exercise nutritional science. And so, while people can't get bachelor's, getting a doctorate through a university is difficult unless you can find one that actually offers that. Now, for it to be a university, for me, it has to be recognized by someone. If it's a medical school, it should be recognized by someone like the World Health Organization uh, and the government where it's at. If it's a university, it should be recognized by whatever state educational system recognizes that. But the thing is, like I said, there probably are some places which can give you a doctorate in martial arts. But the thing is, are they really giving you a doctorate, or are they just giving you a piece of paper that gives you a doctorate? Now, I do have a couple papers that rank me at a different level of martial arts. I have a different ones that actually do show that I have an MD, and I can show that I teach at community colleges and have taught at universities. But that's not the case. That's not the. I'm not going anywhere with that. But what I want to say is this: it's when you're dealing with rank, a lot of ranks are different depending on organization, and like I said, even schools. Sometimes within the same organizations, two schools will have completely different requirements. Now, as I mentioned this, I actually remember talking to someone about kids having black belts, and a lot of people know they can't have black belts. For me, a black belt is a professional rank. And there are children who are competing in the professional level. They're actually competing and making money as martial artists. If you have a kid who's doing that, that's a professional rank. If a school decides that a 5-year-old is at a professional rank because he's doing something in the dojo, well, for that school, that's a professional rank. Now, I tend to lose a lot of faith in the ranking system because I have seen people in different organizations who may be 7th, 8th, 9th, 10th degree black belts who couldn't punch through a wet paper bag. I have also seen people who are brown belts who I would say, yeah, that person is dangerous, can actually hit, understands basic concepts. And so the thing is, the black belt system really is mostly it's only useful within an organization, and even there, it's hazy. Actually, you have a friend who has been training at least since he was 15. He's in his 70s now, and just recently earned his 5th dan, and I would want to congratulate him. But the truth is, even if me and him were at the same rank, I would not be arrogant enough to say, "Hey, I know everything he does." He's actually shown over time that he's been training longer. He's older. Has more experience with this, and he also has been training with the right people. So he has the right people, the right time, the right technique. You watch one of my I call him my sensei, hit Makiwara. You know that this guy knows what he's doing. And so that's one of the things is even within organizations, a lot of times you will actually look at people who know something and you'll go with them, not necessarily being the highest rank. I will say the people who are actually higher rank in the 6th, 7th, and 8th, 9th, and 10th in my organization, I am actually pretty impressed with them. And so I do tend to train with them when I can. That said, I have actually met some people, like I said, who they're 10th dance, they're the head of their organizations, and they can't do what I would expect a showdown to do. Ranks don't transfer over. Again, there's actually some people who I have a lot of respect for who don't have showdowns, but if I ask them, hey, if I see them, I would be like, hey, teach me that technique because I like the way you do it. And so that is one of the things that a lot of times people talk about rank and so and so should sensei. Well, like I told someone, that's like some people refer when I went to Okinawa the first time. Some people referred to me as sensei because I have an MD. It's just the way it is. And yes, even in a dojo, some people would be like, "Oh, sensei, explain to me this." And one of the things, actually, Matt, who actually runs a karate blog, he actually mentions that it's sensei is not a title that you earn. It's a title that's given to you when people see you as someone who can teach them something. And a lot of people will know that's not the way it is because my teachers different teachers will do it different things. My teachers did it a certain way. Someone else's teacher will do it a certain way. And this whole idea of rank usually gets overplayed by the commercial aspect. But besides that, I did want to talk about skin and how to cut. Now, I actually saw someone talk about how, okay, someone grabs someone with a knife and they start doing this. And they say, oh, you're cut. You're cut. Now, if I do that here, I may actually get little cuts. But a lot of those cuts, as I'm going to show you, are superficial. To actually do damage, you need to actually get to some sort of artery, vein, and nerve, which means you have to go through skin. Now, how sharp is this knife? Well, I actually did sharpen it. You can see paper. Someone told me that this is the best way to check it. So you can see it cuts paper pretty easy. It's pretty thin, but you can actually see that the cut is straight, no jagged edges. Actually, it's completely straight so it's completely smooth. So I am going to use my pig's foot again. And one of the things with the pig's feet is, again, it is a lot like a human skin. So what I'm going to do is I'm going to grab my pig skin like this. And if it was here, I would be doing this. Now, one of the things you'll notice is even with the sharp knife, the cut I'm getting is minimal. If I actually, let's say I go in here. There, now I actually cut. Now this would bleed. You can see this would bleed. But that's a superficial cut. It's actually only cutting the skin. If you look inside, underneath everything, you would see that the muscles, tendons, they may have a little cut, but it's not anything life-threatening. So while someone is holding your knife and people are coming across here, what you would be doing is you'd be getting superficial cuts, but it's nothing that would actually end up hindering someone from doing something else. If it's all you have, well, that's fine, but the thing is, there are other things you can do to get out and attack again. To just think that you're going to do a lot of damage cutting across here, well, like I said, with a sharp knife, which you saw the sharpness, if I'm just coming across here, I can cut the skin. I'm actually trying to here, but it's only going through the first layer. Now, if you want to know more about skin, you can. What I will tell you is this: skin has 3 layers, and it is actually a strong tissue. The first layer is called keratinized stratified squamous epithelium. The outer layer of skin has at the outermost layer of the keratinized stratified squamous is dead skin cells. It's just a protein. Those are the things that they flake off, no big deal. Underneath it, you start getting cells. Now, these cells are actually dividing from the bottom and moving up. And as they move up from the basal lamina, basement membrane, and move up the lower level of that tissue, it gets away from blood supply. You actually have these capillaries thin on the inside of the skin. Now, when you get past those capillaries, when you cut those capillaries, they bleed. But those are bleeds like when you nick yourself shaving. So that's actually the type of bleeding that you will be doing if you're coming across coming across here, like that. If you actually are getting deeper, you can then cut the first layer of skin. And what I'll do is I'll shave the first layer off. So I'll take a little piece here. It works. Take this piece. Oh, sorry, it's taking me so long. You can see how hard skin really is here. Okay, so here I have some skin. Now, if you don't believe me that skin is hard to cut, go ask your local butcher. He'll let you know too, because I asked and the guy told me, "Oh, you're gonna cut skin, huh?" Yeah, and I did buy a piece of skin so I can cut it in front of you. So here's skin. That's skin, and if you've actually done any dissection or if you've done any human cut, if you notice that that's about the thickness of human skin. Now, one of the things you'll notice is you have actually 3 layers. The innermost layer is that it's kind of a wiggly type layer. You have fat underneath it, and then you have, which is called the subcutaneous layer. And then, if you look closely, you might be able to see here the outer layer of skin is about a fingernail thick. And then you have the dense, irregular connective tissue, which gives you a lot of the movement. So those are the 3 things you're going to be going through. The first layer of skin, the hard one, if you're trying to cut through it, it really is, like I said, mostly cells. The next one is the dense, irregular connective tissue, and you still haven't reached arteries. Over here, you've just reached capillaries, which are small veins. They will bleed, but it won't be a big deal. As you go below it to the subcutaneous layer, you then end up in the subcutaneous, where you have fat, is where you start getting your arteries, arterioles, that you can actually cut. Then beyond that, to go really deep, to cut an artery, you have to go deep. It's not a, oh, I'm going to cut here and do, it's not a, I'm just going to cut like this, and if you're trying to get an artery, you have to go in. If you want to get tendons, ligaments, you have to go in. Look at our pig's foot, for instance. You'll notice the skin, the layer of skin I was telling you here, you have more connective tissue underneath, and then you have the tendons and ligaments here. And so the thing I'm trying to tell you is it's not as easy to cut through skin as most people think. Most people have never cut it through skin, or if they did, it's a thin piece of chicken skin. And so that's actually the big thing. Now, like I said, I do like to do these experiments, do like to see what people are trying to talk about and find this. Now, I will tell you that one of the people who I know who does Filipino stick and knife fighting was telling me that when he got he actually was the one who talked me into doing this, because he was telling me that a lot of times here in the U.S., people don't understand what it is to cut through skin. He was telling me that for his test, he was asked to slaughter a pig, and you end up finding out how deep everything is when you have to kill something. And so he actually told me that it's like, a lot of people here start doing stuff that, outside of the, the realm of, oh, I touch you and boom, look, hand comes off. They don't understand how hard or how much technique you really need to use to cut through things. So he actually said he thinks it's really beneficial for anyone who's teaching knife fighting to actually go kill something, just so they can see what it's like. I don't mean kill something for fun, but whatever he killed, I think he told me they made a barbecue after it. Well, I'm not killing stuff, but you can actually use the, you could go to a butcher shop, buy skin, buy arteries, buy all the stuff that most people use for soup, and you can end up actually testing a lot of the ideas you have. Again, I would like to ask if you're looking for different things in martial arts, if you want a book which is it's written like a novel based on how it is to go to Okinawa. I do have Serious on the Rarest Things. If you buy it, does help support this channel a lot. If you want something about traveling through the U.S. And trying different martial arts, I have Off the Rails. Breaking Points is still available. The Human Anatomy, a clinical approach, will be available soon. And I am on the process of making a book on body movements for martial artists. This should actually, I think eventually what would happen is you do the human biology for the body movements for martial artists, then go into human biology, so you have some reference points. But I'll let you decide what you want. And if you have read any of the books, please comment below. Let me know what you think about them. And I'll hopefully see you next week. Bye-bye.